Hello everyone and welcome. If you have been dealing with the low back pain that just won't go away despite the medication, rest, exercise or even treatment, you are not alone. Many people struggle with persistent back pain not because it is untreatable, but because key factors are often overlooked. Today I will explain why back pain sometimes doesn't improve, the common mistakes that patients unknowingly make, what science says about recovery, and what you can start doing today to change the trajectory. This session is about empowerment and not fear. So first, let's normalize something. Back pain is extremely common. Most episodes improve within weeks. So back pain is extremely common and most episodes will improve within weeks. But when pain persists, it doesn't always mean damage. It often reflects multiple factors, and recovery requires a broader strategy. So when the pain that you have persists, it doesn't always mean that there is a damage. It often reflects multiple factors, and recovery always require a broader strategy. So the pain that you experience is influenced by, number one, we have the physical factors. Now the body's physical factors that influences your pain. Number two, we have the lifestyle habits, how you carry out yourself. Are you living a sedentary lifestyle? Most of are you spending most of your time indoors or are you exercising? Then number three, we have stress and sleep. Are you always stressed? Do you get enough sleep? Then activity levels. How active are you? Are you usually active or you do not engage in physical activities? Then your beliefs about pain. So those are some of the things that influence your pain. I have said we have physical factors, we have lifestyle habits, stress and sleep, activity levels, and your beliefs about pain. Understanding this will help prevent your frustration. Understanding this will prevent frustration. So what is the number one reason why you experience back pain that doesn't always improve? So number one reason is that you are avoiding movement. So this probably is the biggest barrier to recovery. Avoiding movement is somehow or probably the biggest barrier to recovery. Many patients believe that if I move, I will worsen the injury. Many, many people who undergo rehabilitation after experiencing back pain, they always believe that if they move, they will worsen the injury. However, that is not the case. But exercise, rest can do some wonders of the body. Exercise can do wonders to the body. That's why we always encourage movement. But if you engage in excessive rest, the rest can do certain things that will increase your pain. Number one, it will increase your stiffness. Excessive rest will increase your stiffness. Why? You do not engage in physical activity and therefore your mobility decreases. How you tend to move, your flexibility, it reduces, and your stiffness will increase. Number two, we'll have weakened muscles. So if muscles are not put into active use, they will become weak. Then number three, we have reduced blood flow. So your the blood flow to the muscles at the back region will decrease. The blood flow will decrease. And remember, it is the blood supply that provides the nutrients and always provide fresh products as it clears out the wastes. Then heighten pain sensitivity. If you engage in excessive rest, your pain sensitivity will shoot up. So those are some of the things that excessive rest can cause. Excessive rest can cause increased stiffness, weakened muscle, reduced blood flow, and heightened pain sensitivity. Your pain sensitivity shoots up. Then modern rehabilitation usually encourage controlled movement. So you should always engage in controlled movement, usually with the aid of your physical therapist or your trainer. You should engage in controlled movement. Number two, gradual loading. What do we mean by gradual loading? You do things progressively, step by step. You do not move from zero level to a higher level. You do things gradually. Then consistent activity. You should not engage in an activity, let's say in a week, you engage only once. You should consistently engage in the activity. Consistency will beat the intensity. Then movements help the spine stay resilient. So movement will help the spine stay resilient. So the second reason is incorrect exercise approach. So exercise usually helps, but only if done correctly. So some of the common issues with exercise include doing random internet exercises. So if you usually engage in some random exercises that are not planned, then avoiding intensity too quickly. So if you usually avoid intensity too quickly, you may have a problem with uh, your back pain. Then ignoring proper technique. You should always engage in proper technique as guided by your clinician. Then lack of progression. So if you engage in the physical activities without any progression, so that is what I mean by lack of progressions. The common issues, as I have said, is doing random internet exercises. That is the first one. Then avoiding intensity too quickly. If you avoid intensity, then ignoring the proper technique as taught, then lack of progression. So those are some of the common issues. So effective rehabilitation should include, we have flexibility work. So usually we encourage flexibility in the exercise programs that are prescribed to the patients. So usually if you encounter a challenge with the exercise program that you have, you should be flexible and talk to your clinician or your physical therapist to change the program. Then co-stabilization is another effective rehabilitation program that we include. We usually encourage the stabilization of the core muscles. Then functional strength. We usually encourage functional strength and postural training. Postural training, mostly we encourage it in those who engage in office activity and work desk stations. So for example, if you usually engage in uh, workplace, for example, those who work in banks, the secretaries, they usually engage in typing activities. So they should be trained on the proper posture techniques that they should apply. Also involve those who are engaged in uh, intense physical activities like manual laborers. Then here the key thing is that consistency matters more than intensity. So you should always be consistent with the exercise approach that you apply. You should always be consistent. Don't focus much on the intensity while reducing the consistency. So you should always do it. For example, you can do it 3 times a week, 4 times a week, not doing a heavy load once in a week. We encourage consistency more than intensity. So that was about the second reason, that was incorrect exercise approach. Incorrect exercise approach. Then the third reason is poor daily habits. Poor daily habits. So rehab sessions are a small part of your day. Rehab sessions will always include a small part of your day. For example, if you walk into an outpatient clinic, uh, the maximum you can take is 2 hours. Most of the times it's usually 45 minutes to 1 hour. which is just a small part of your day. The daily habits that you do by yourself often matter more. The daily habits that you do by yourself will often matter more. So examples, we have prolonged sitting without breaks. So if you engage in office work, if you usually do prolonged sitting without break, that is a poor daily habit. You should always have breaks after 30 to 45 minutes of sitting. You should always have breaks between, do some stretches, then go back to work. Another one is poor workstation ergonomics. So if you have poor workstation ergonomics, for example, the chair that you use, your sitting posture, the alignment of the screen with your eyes, then incorrect lifting techniques. So you should always engage in correct lifting techniques, which is usually your foot should be wide apart, then you should bend on your knees. Don't bend on your back. Always bend on your knees. Then sedentary lifestyle. If you engage in sedentary lifestyle, that I promise you, there'll be minimum improvement in the back pain that you have. So small adjustments can reduce the strain significantly. The small adjustments that you do daily will reduce the strain significantly. And you should always think of posture as dynamic habit and not a rigid position. Your posture should be dynamic habit and not a rigid position. So that was on the third reason, which is poor daily habits. And the thing that I have stressed here is that the rehab sessions that you have with your clinician or the physical therapist will form a small part of your day. The daily habits that you do are what matter more. So you should always focus on practicing all that you have been taught daily. Do not wait for uh, the next session that you have been appointed to by your clinician. Always engage in uh, rehab sessions by yourself. Do not wait for the appointment days. And the fourth reason is fear and stress. So fear and stress will amplify pain. Pain isn't purely physical. Most of the time, pain does not always involve the physical aspect of the body. Emotional factors also influence pain. They influence the muscle tension, the tension within your muscles, how relaxed are your muscles, the pain perception. Your emotional factors will always influence your pain perception and your recovery speed. So you should always work on the emotional factors, on the emotional aspect if you are dealing with pain. Always work with the emotional factors. This will help reduce the muscle tension. You will have relaxed muscle and your perception of pain will improve and your recovery will speed up. The common contributors to this are always anxiety about injury. So if you always have anxiety about injury, that will amplify your pain. Then fear of movement. You should not be afraid of movement. And if you happen to experience any fear of movement, usually always consult with your exercise trainer, your physical therapist, or your clinician to see on how they can help you. Then also work on stress. You should always work on the stress, especially the stress that you experience at work. That will always help in the emotional aspect of the pain. Then poor sleep. Are you having a poor sleep? Are you having a good or a quality sleep? So those are some of the common contributors about the pain, about the fear and stress as they amplify your pain. The common contributors, as I have said, are anxiety about injury, fear of movement, the work stress, and the poor sleep. So you should always work on those. Chronic stress will keep the nervous system sensitized. So if you have chronic stress, your nervous system will be sensitized. Relaxation, reassurance, and gradual exposure will help. So always engage in relaxation activities. You should always engage in relaxation activities. This will reduce your fear, your stress, and work on the emotional factors. Then reassurance. Always get reassurance from your physical therapist. Then gradual exposure. You should always encourage gradual exposure. That was on the fourth reason, that was fear and stress amplify pain. Then reason number 5 is that you expect quick fixes. In rehabilitation, there are no shortcuts. No quick fixes. Many people always want instant relief. They want a single magic exercise and one treatment session. That doesn't work in rehabilitation. That usually doesn't work. Instant pain relief, no. Rehabilitation is a process that takes weeks, months, and sometimes even years. So you should not always expect the quick fixes in terms of instant pain relief. Your pain will always decrease as time goes. Then a single magic exercise. There is no single magic exercise that will relieve your pain completely. There are certain techniques that are used to relieve your pain, and they will tremendously help you with your pain. However, if you think that there's a single magic exercise that will help clear your pain, that doesn't work. Then one treatment session. You must engage in guided treatment sessions. There is no one treatment session that will help fix you. So recovery always involves gradual tissue adaptation. So what this means is that your body tissues like the muscles, the tendons, the ligaments, they always adapt gradually. So that is what recovery and rehabilitation always involve. Gradual tissue adaptation and habit change. So the habit will always change gradually, day by day, and strength rebuilding. Remember, there are weak muscles that we need to strengthen. For example, the core muscles, they need to be strengthened. So it involves rebuilding, and consistency will win here. So consistency over time will win. Consistency and patience is therapeutic at this point. So you should not always expect quick fixes. However, you should demand quality. It is your right to demand for quality rehabilitation, but there is no quick fixes. You will always have treatment sessions that will be planned, and there is no single magic exercise that will help you. So reason number 6 is missing the bigger health picture. So certain other factors that may affect recovery will include weight management. So are you managing your weight? Are you managing the ideal body weight that you should be having? Your physical fitness, how fit are you? Your nutritional status, are you engaging in a quality diet? And the sleep quality, how is your sleep quality? And also the smoking status. So the smoking status also impacts the back pain, and this I will explain later. The smoking status. So these are the other factors that affect recovery. Weight management, you should always manage your weight. Physical fitness, always stay physically fit. Your nutrition status should always be checked, and you should have a quality sleep. And also, you should avoid smoking at all costs. So, all body health will support the spinal health. Your whole body health will always support the spinal health, and ignoring this will slow the progress. So remember that the body works as the body works in a multi-system. Let me say that, in a multi-system. So having a back pain can be influenced by the nervous system, it can be influenced by the musculoskeletal system. So those are certain systems that are always affected. And a problem with the back can always arise from from the chest region. An issue with the nervous system can always cause a problem with the back. Can also result from your weight, excessive weight. That's why I have said that other factors that affect your recovery will include weight management. Always manage your weight. Physical fitness, always stay physically fit. Your nutrition, engage in quality diet. Uh, Sleep quality, always ensure you have quality sleep. Your smoking status, avoid smoking at all costs. And always focus on your whole body health. Always focus on your whole body health. So that was on the sixth reason, which was missing the bigger health picture. So when should you seek professional help? When should you seek professional help? So some of the important warning signs will include persistent numbness or weakness. Persistent numbness or weakness. So if you realize that you, out of nowhere, you experience weakness within your limbs, you should always seek professional advice. Or your legs or your back become numb, then severe night pain. Severe night pain, this is a very critical warning sign, and you should seek medical attention immediately. Severe night pain and trauma history. So if you have any history of trauma in the past, history of falls, history of accidents, you should seek medical attention. Loss of bladder or bowel control. So if you have any problem with your bladder or bowel, seek professional help. And unexplained systemic symptoms. Unexplained systemic symptoms. This can include severe weight loss. So in case of such, you should seek professional help. So those were the important warning signs. I have said they include persistent numbness or weakness, severe night pain, history of trauma, loss of bladder or bowel control and unexplained systemic symptoms. Professional assessment will always ensure your safety. So at this point, professional assessment is very critical as it ensures your safety, and early intervention will prevent chronicity. So if you have early intervention at this point, the chronicity of your problems will reduce. So what are some of the practical recovery strategy? What are some of the practical recovery strategy? So here is a simple framework that you can use. Number one, stay actively safe. Avoid prolonged bed rest. In case you have back pain, do not engage in prolonged bed rest. Avoid prolonged bed rest. Stay actively safe. Number two, you should follow a structured rehab. You should get a professional guidance if possible. If possible, let them structure for you your rehab as you should progress. Follow a structured rehabilitation program. Then number three, improve on your ergonomics. Your workstations and your daily habits matter most. So you can consult with your clinician or your personal trainer or your physical therapist about your ergonomics, about your workstations, and the daily habits that you should engage in. Then number four is manage stress. So relaxation techniques will help recovery. Relaxation techniques will help with recovery. Then number five, you should build strength gradually. So build your strength gradually. Your core stability will protect the spine, and small steps will compound into big results. The small steps that you get will compound into big results. So if your back pain hasn't improved yet, it doesn't mean that it will never improve. Recovery is often about having a better understanding of your pain, having smarter habits, consistent effort, having guidance, having proper guidance. So your spine is always adaptable and healing is possible. Progression is achievable. The progress that you need is achievable. And always stay active, stay hopeful, and keep moving forward. Thank you for your time and take care of your back. So if this made sense, please like, share, and subscribe. If you have any questions, you can drop them below.